Good afternoon, ma'am.
Hope you all are doing well. Let's move to the today's session. Can you all see my screen?
Yes, ma'am.
Okay, thank you. So today's session is regarding the how we are going to take this assessment, right? So these are our learning objectives. At the end of today's sessions, you will be able to explain how you can take an assessment if it is in a health and social care setups. As a healthcare professionals, when you are going to work, how you can take an assessment means what are the things that you need to be emphasized when you are taking in your assessment. And that means prior to assessments, what are the things you need to plan, and during the assessments, what you are going to concern, and after the assessments, what you are going to do. These are the things will be included under the topic explain how to undertake an assessment. The next one is another most important one, the referral system. The referral system. So normally you can come across this word referrals, right? Referrals means we are referring something or we are referring to another person. So that's we are telling as a referral system. This referrals or the referring system is also another commonest thing you can identify in the health and social care sectors. So why we are referring and why we are having this referral system, the basic concept is for the effective care management. For the effective care purpose for the patients only, we are having this referral system. So today we are going to see the definition for the referral system and when we can use these referrals. What are the situations we can come across to use these referrals, and what are the advantage of using the referrals, and what are the levels. So there are different levels are there. You can use these referrals, and what are the guidelines or principles are there in order to use this referral system, and identifying the factors which are affecting the referral system, and finally we are just briefing out the steps that are included in the referral process. So these are the contents of today's session. We'll see one by one. So first step is how we are going to undertake an assessment. What are the things that we need to see when we are taking an assessment? Actually, assessment is also, we are normally telling it as a process. So we already studied the term process. Process means definitely there could be some sequential steps or orders are there. So first this will happen, then next this thing will happen. So likewise, we are having a steps. So for the assessment making also, we are having some set of steps in order to have the assessment that we are getting from a patient to be an effective one. So we'll see what are those steps. So step one, clearly define your assessment objectives. Yes. So this is the prior planning for the assessment. If you are going to make any assessment from a particular individual, first you need to set out the objectives. Or in other terms, you can tell it as the outline. So these objectives, outlines, aims, or goals are similar terms or the purpose. So that means why you are going to make the assessment from that individual. So when we are telling as an objectives, first you need to know why you take. So if you're going to make an assessment from an individual, that means you identified a problem from that particular person. It is not only individual, you can take it as a group of people, or it can be a public community. So whatever the levels you can take, right? So if it is an individual or a particular group, then first you need to know. So why did you choose this topic or why you are going to take the assessment. Okay, so that is your objective purpose. For example, uh, you are going to make a survey. Survey means it's a kind of research. So you are planning to do a research under the topic of oral health. Oral health means the oral cavity. Okay, so oral cavity means our mouth. Okay, the hygiene of the mouth. That means your research is defining that you are going to check how the students, that means the children who are school going children, we can take about grade 6 to A level. So now you are going to check how the students, that means the people who are studying from grade 6 to 12, having a knowledge regarding to maintain a good mouth care or the mouth hygiene. So how you can do, you can make a questionnaire. That means questionnaire means you can prepare a set of questions which you need to take informations from them. For example, you can ask how many times they are brushing their teeth and how they are brushing their teeth and what type of components, whether they are using tooth powder or toothpaste and brush, or sometimes they may use some equals like that, of whether they are using fingers to brush their teeth. So likewise, you are making a set of questions, and under each and every questions you are giving some answers. It can be a multiple choice questions, like it can be 4 answer or 2 answer. So you can give those questions to a definite population, that means from grade 6 to grade 12, and ask them to mark those answers. Okay, then you are collecting from them, and then we are going to analyze how the each and every age group of students are having a knowledge level, whether they are good or whether they are bad. So it is a kind of assessment, because for your research purpose you are need to get these kind of informations from a particular target population. So why? First, you identify that especially the students who are going to school, they are highly prone to get this mouth hygiene problems, right? That means oral cavity problems. Why? Because the school going children means they are very, very small children. That means small people. So they are having a habit of eating a lot of chocolates, sweets, candies. And when we move to the students who are studying about grade 11, 12, sometimes with the change of their age, they may sometimes prone to have a habits of betel chewing and sometimes alcohol consumption, smoking. So that means due to their developmental process, there are hormonal changes and they may start to expose to the community. So if they have any bad relationships or bad interconnections within the community, they start to get all these kind of habits, right? So in order to identify the knowledge, first you are going, because you find out this is the commonest problem prevailing among the student community. So for that, you need to gather the informations in order to get the detailed idea how you can sort out this problem. So for that, you need to get the information. So gathering the informations only, you are doing the assessment in the form of giving questions, a set of questions to each and every people. So here your objective is to identify the knowledge of the oral hygiene or the practice or attitudes, whatever prevailing among the student population. Then you need to identify the definite audience. So audience means who are the target population, whether it is a single individual or it is a group of people. For as this example, when you take, it is a group of people, right? A student population from one school or two school. Or are you targeting a community? Community means you can take a particular MOH area. Like when we talk, it can be Trincomalee MOH area, or if it is in a Colombo, your MOH area. So that means it is a particular community you are taking, because MOH area means you can identify different age group of peoples are living and different ethnic groups of people are living. So who are following different religions and they are having different language types. So that's why we are telling them as a community. So you are taking a part of community for your research. So that is your target organ. So first you need to plan all those things. It is the first step. Clearly define your assessment objectives. That means you need to be very, very clear about your objectives before undertaking assessment. If you are not clear about your objectives, what are you going to do? What are the outcomes you are expecting? So if you are not clear, then when you're undertaking an assessment, you won't get the actual informations from the target audience. Then it won't give a proper outcome. Then the energy, resources, time, and the efforts you made will become fake. Okay, so first step is clearly define your assessment objectives. When defining your objectives, ask yourself. So you need to ask yourself, why are you conducting this assessment? Yes, so why you are conducting this assessment? So when we take the example I told you, so why I am going to conduct this assessment? Because I find out that the oral cavity or the oral problems are the major problems prevailing in the Sri Lankan community. So it should be sought out from the beginning part itself. So from the beginning means we can easily spread the informations through the student community, through the children, because children or the students, those are the future citizens of each and every country. So if we spread out the essential informations from the small age onwards, then they start to practice in the future. Then in future, once they become an adult, then they can teach to another group of people. So it can be easy, because when compared to adult, we can manipulate the children's according to our wish and will, because they are very, very small people, right? So we can tell them, they also accept whatever we can tell. Some kind we can make them to convince when compared to the adult people. So that's why we are commonly taking this. So that is the reason for conducting this assessment by myself. Then, what do you plan to do with the findings of the assessment? Yes. So why? Okay, you are going to take this assessment. Then what your purpose of taking this assessment? Why? What will you do with the findings, with the results of this you are getting? So what can I do? So I'm thinking that if the findings are not good, that means if the knowledge or the attitude or the practice related to the oral hygiene prevailing among these students, if they are not good, then I can educate them. So if educating means how you are educating. So another question you need to ask, okay, so you are going to educate to create a good future Sri Lankans. So if it is a sense, then how you are going to educate them. So how I am going to educate those students, I can conduct a workshops to them. Okay, so and also normally in we normally it is not, I'm not sure whether they are following no, regularly, but there is a circular that we are having in the school. I hope that for every 6 months or 3 months of period, the particular MOH area, the particular MOH divisions, they need to prepare a dental visit to each and every schools they are having. A particular, if we take a particular zone, that zone having the MOH area, so the each and every schools need to have a dental visit for the dental screening program for the children. But I'm not sure whether they are following in nowadays also. but mostly they are not having that regular dental visit to the schools nowadays. So how then, if it is not the case, then what can I do? I can arrange those activities as well. How? I can conduct with the school principal whether they are having these dental programs. If it is not, then I can aware those people. So we need to, there is a circular available. So you need to arrange for the dental screening, then only you can have. And another thing is we can include this importance of oral care and the dental health problems into the curriculum of the student. So we can emphasize those things in our workshops, or we can do some street dramas. I can collect my group of people and I can do some street dramas, or distributing the leaflets regarding the importance. So those things I can do as an education purpose. Then who are the target population? Okay, so to whom I need to do. So the target population means who are the audience to whom you are going to plan all the things. So the target population is the students. So students means you can take whatever the age group. So I am taking from grade 6 to grade 12 or 13. Okay. So this is when defining your objectives. The objectives also suggest that surveyor and or focus group questions should target topics including but not limited to the knowledge, intention, assets. So yes, so another thing is when you are focusing the objectives, so sometimes I'm going to check only the knowledge of the person, right? So if I'm going to check the knowledge of those particular audience, the questions you are going to distribute to your target population not only confined to the survey purpose only. That means, so you are not only getting the assessment only for assessing the knowledge. If you find out any gaps in the practice or in the kind of attitudes, then you can incorporate them also into the survey, because it won't cause any kind of problem into your survey, right? So if you find out any gaps or any abnormal findings relate other than the knowledge, then you can incorporate those information as well, right? So this is what we are going to do as a first steps to clearly define the assessment objectives, right? So are you all clear up to now?
Yes, Miss.
Okay. Then we'll move on to the second part. So now I'm telling for as an example, I'm going to do a survey, right? So first I find out the objectives and I define my capacity. Yes. So although you are going to plan your objectives and everything, resources that are available and the transport facilities. Realistic about your resources and the capacity and your capacity as well. So capacity in the sense, if you are going to include if I'm that means I am planning to include all the people who can talk all three languages. That means Sinhala people, the people who can talk Tamil, and also the people who can talk English. So if I'm going to use or also may arise questions from you. So why? They may have different questions. Sometimes the questions that you are provided will not be clear. So they can ask. And sometimes when you are interviewing, that means when you are asking the questions verbally from the person, then in that sense also they may develop different questions to you. So in that sense, if you are going to include all the three people, then you are very competent enough to reply them in their own language. Okay, so if the person is a Sinhala person and if the person doesn't know Tamil or English, and if he or she arise a questions, you also need to answer. They mean Sinhala. That means your answer should be very perfect and it should be very clear to them. Other than that, if you are going to answer in English, then there is no point of including them. So before or so when you are planning, you need to be plan all those things about your competency, your capacity, and you need to be check the available resources. Consider how much time, money, and staff capacity you can devote to undertake the assessment, right? So for example, if you are going to do it as a very large survey, sometimes we are doing as a community survey. Community survey in the sense it cannot be undertaken only by a one person. Okay, so we are creating a team members, and each and every jobs are allocated for each and every one. One person is responsible for I'm just telling that we are going to check the obesity, that means overweight. Okay, overweight and with age, how the overweight, that means increased weight, is changing according to the age prevail among the community. In the sense means if you are going to take a community, so a lot of people will come. It is not possible to conduct by one person. So we will form a team. One team leader will be there. He or she will be coordinated each and everyone and each and everything, right? So he is responsible for supervising and coordination. Then one person will be allocated for measuring the weight of each and every individual who are coming for the survey, and another one is responsible for measuring the height. Then those measurements will be given to another person who is responsible for calculating, and then another person for analyzing according to the calculations. So likewise, the community survey is going on. That means if you are going to take a large population like Trincomalee district, Colombo district, Jaffna district, or Eastern province, Western province, so that means it is a very large population. So for that, if you are going to do those kind of assessment, first you need to check whether the staffs are available. So, and the available staffs are competent enough to do their assigned roles properly. If the person is not know how to calculate the BMI, the body mass index, then there is no purpose of taking that person or appointing that person. Or if you are going to appoint a person as a leader, then he or she needs to be a very uh, having a leadership quality. Okay, so she needs to have a very good leadership quality. Then only she can coordinate with among their team and with the people and with the team members. Or if we are going to take any help from outside or the external organization, then there should be a coordination and needs to have all the plans properly. So in that manner, the particular person appointed as a leader, he or she needs to have a good leadership skill. Okay. So in that manner, you need to check each and every staff about their availability and their competence. Then time. Okay, so sometimes you need to plan because all the researches cannot be done until the death of the life, right? So we need to prepare it. Within 3 months, you need to finish. Or some survey, it may takes 1 year. Within 1 year, you need to finish. So if it is a 1 year, then the resources and the money that we are going to spend, it's kind of a big budget. Okay. So you need to check all the things and you need to plan before getting. For example, do you need to assess the current state of your program and implement changes within 3 months? Or do you have an entire year to examine your program's effectiveness? Yes. So first what? So you need to assess. Okay, first you need to assess your planning, that whether the current state of your, that means if you already planned and now your program that you have planned is going on, right? So previously you planned it for the 3 months, but in between the program you need to check the effectiveness, whether we can finish it within 3 months or we need to change the time for the 1 year. If you are going to extend the time period for another 1 year, then whether the staff are available, whether the resource you can get enoughly, and how about the financial support, all the things you need to be checked if you are going to change anything as well, right? The availability of resources will greatly impact the assessment activities you are able to conduct. Yes, so the resources is important. So here the resources means not only the financial resources, it can be the questions even you are getting from any other people, the questions and the manpower. Even if sometimes you need to do any surveys, if you're going to do a survey as a single person, so you are only doing the surveyor, then you need to identify all the competencies, abilities and capacities you can get. And other resources means other things that you are needed. So for example, I told you know that if you are going to check the overweight influence, then you need to measure the height and weight. So for the weight measurement, you need to take the weighing machine, beam balance, and for the height, you need to check the stadiometer. So those availabilities you need to check. And for the analyzing and the results, you need to have the computer literacy. Okay, so all the things will be done by a software method. So you need to check whether you are having enough computer literacy skills, or whether you're one of a team member good enough with the computer knowledge. So those things you need to check. So resources means that one. So when any kind of assessment, you need to be very, very careful because these resources are having a great impact on your assessment part. Okay, so this is the step 2. So you need to be planned according to the available resources and your capacity. Then step 3, identify the target audience and data sources. Okay, so first you identify your objectives and then you create and you formulate a planning according to your identified all the resources and the capacities you are having. Now you are identified about your target audience, right? So you need to identify who are the target audience are. Given your objectives and resources, consider the target audience and data sources that will help you to assess your needs, right? So although you have selected a particular target audience at the very first step, but once you start your assessment for the surveyor, sometimes you may feel that the chosen target audience is not proper, right? So that's why normally what we are doing is, if you are going to do a research or surveys, before we are approaching the main target group, for example, as I already told you, I am going to check the oral hygiene of a I'm taking one school, only one school I'm taking. So in that school, my target population will be the students studying from grade 6 to grade 10, right? So from grade 6 to grade 10. So before approaching that particular school population, what I am going to do is I am going to select another school, and from that school, the similar population from grade 6 to grade 10, I will take or I will pick up randomly only about 20 students, right? So for example, from grade 6, 5 students, from grade 7, 5, likewise, it can be 10 to 20 students. I am just taking random. And then what I'm going to do is I will provide, if I'm having any questions, then I will give the questions to them and get their answers. Or if I'm going to do an interview, then I will interview each and everyone and I will get the results. So why I'm doing this is because I'm checking whether the questions that I'm going to provide for gathering the information can be read by each and every individual, if they can understand or not, right? So that is the way, because prior to approaching, because once you start your survey in your target population, in between the survey you can't stop it. Why? Because there will be, actually it is very a great loss, right? So before approaching the actual target population, we can take a similar group, so the similar age and the similar group of people as a sample, right? So normally we are telling it as a pre-test. So pre-test I am doing to check whether the questions or the whatever I am going to use on my target population for gathering the information are reliable. That means whether I can use them. So if we take the same set of people, then we can analyze the results, how their results, right? So sometimes some may tell that, or during the assessment also, we can come up with so many questions, right? So why? Because the questions that are get by each and every age group of people will be sometimes similar, okay? Their thoughts and minds, sometimes most of the similar age group of people, mostly they have most common ideas and thoughts. In that sense, we can get those ideas, and if I find out any new things, then I can change my questions or the instruments that I'm going to use. Then after all the modification, I can approach the actual population directly. Okay, so that is also important when you are gathering the information. It is most effective to administer a survey to a wide range of community members, to hold several focus groups with the hospital administrators examining existing reports. Yes, so it is effective. So when we talk about the community members, right? So where if you are going to take your target audience as a wide group of people, it will be more helpful. Why? Because wide when it is community means you can encounter different ideas of the people. That means you can identify diversity, right? If it is a very large group, you can have a diverse characteristics, diverse ideas and thoughts. Then it will be very helpful for the future activities as well. That's why we are telling that your target audience, if you take a wide group, it will be helpful. Also, consider the competing priorities of the target group and how to encourage them so participate in your assessment. The another important one is when you are approaching your target audience, you need to identify what are their needs, what are the sufferings they are having, right? So in your assessment, you need to prioritize those things. That means if you are going to do a research, so your research objectives or the goals should outline the major problems or the immediate needs of the particular target population. So you can address those problems and incorporate into your research. Then you can do your survey in a proper manner. So then only, and also if you the another advantage of incorporating these things, so because the people, they will come forward to provide their answers to you. Why? Because you are addressing their current issue, right? So that's why we are normally taking, whenever we are doing any research or survey, we are taking the current issues of the present community. What is the most important needs of the particular community? So in that manner, one advantage is more and more people will encourage themselves and they start to involve in the particular assessment. Because why? We are addressing their current problem, no? So in the sense, they may think that, okay, if we provide more information, then we will have a good solutions for the particular problem. So that's why that uh, thought they will develop and they start to engage themselves more. Then it will be benefits for both the sides. So how you also can get maximum informations, and with that informations you can provide a good solutions to that problem as well, right? So for example, if sending surveys include an introductory sentence that shows your appreciation and why the survey responses matter, right? So it is also another important one. If you are giving a questionnaire, so in the questionnaire you can um, address them. Okay, so like you can give who you are and why you are going to do this survey. And if you are going to do this survey, what are the benefits that target audience may gain? So likewise, you can give all the informations to them, right? Then the people also know why you are coming and why you are asking these set of questions and what are the gain, especially when you are addressing, you need to mention the gain of your person side as well. Why, if you are mentioning the gain only, they can more and more people will come and involve, because if one set of people come for the first session, then if they identify that they can get more solutions for their current issues from your survey, then they will go and spread those informations to the other people. Then again, you can have the chance of getting more and more audiences for your survey. So that is, we are telling that identify the target audience and data sources. First, you need to approach. You need to know the very good pattern of approaching your target audience, right? So it is the step 3. So are you all clear up to now? Sorry.
Yes, miss.
Are you okay? Thank you. Then we'll focus on the step 4, right? So step 4 is telling think small and big when summarizing the results, right? So up to 3, first we identify the object. That means prior to the assessment. Okay. So the step 1, 2, and 3 mainly focusing on the assessment, that means gathering the information. So first we are clearly identify the problem, and we are clearly find out what are our objectives and our target population, all those things. And then you need to plan about your capacity and the availability of resources. And the third one is you need to address and approach your target population. So then after you approach your target population, so you get all the information. You gather the information, right? After gathering, what you are going to do, you need to analyze for the results, right? So after analyzing, and once now you in your hands, you are having the results. So how we can summarize the results? There is a way of summarizing the results as well, because if you summarize the results in a proper manner only, you can come up with the new solutions. At one glance, you can come up with the new solutions, right? So for that, your analysis, your result summarization should be very, very clear and accurate one. So how you can summarize? So when you are summarizing, you need to be think small and big. So what is this small and big means? Once you completed your data gathering, summarize and reflect on data for each of your assessment objectives individually. Okay, so how you are going to summarize your results means at first you planned some objectives. That means your goals. What are the objectives or what are the things that you are going to check? Right? So for example, if I take the same example, the oral hygiene knowledge prevail among the community means, so how you are going to check is, first you are going to, my objectives are, I'm going to check the knowledge with the age, right? Because I'm taking from grade 6 to grade 10 no? So I'm checking the knowledge with the age. And the school that I selected, if it is a mixed school, that both girls and boys are studying, then I'm going to check the gender. Okay, so the gender and the knowledge influence. How? Because because we can't tell that although the males and females from grade 6 of people are following the same method, right? No, actually, by nature, there are some differences prevailing among the boys and girls with the same age group, right? So in that manner, I can check how the gender going to influence the knowledge. And apart from age and gender, each and every group of people, that means from grade 6 to grade 12 means their educational level also difference, right? So the grade 6, when compared to grade 6 students, the grade 10 students, they may have a more amount of knowledge. They acquire more knowledge because of their educational purpose. That means educational level according to their curriculum. Sometimes the grade 6 students were not that much aware about this oral hygiene. But when we talk about grade 10, they are very good about their oral hygiene because they are having the curriculum in their when they are studying in grade 10. So in that manner, I can check with the educational level and the knowledge of the oral hygiene status, right? And the other thing is regarding the economical status, socio-economical status of each and every individual. So although the students are very knowledgeable, and normally this socio-economical status, we can go it for the practice, right? Because although the students are very knowledgeable, if they are coming from a poor economical background, some parts they cannot be fulfilled due to the financial crisis, right? So in that sense, we can identify how this socio-economic is going to affect the oral hygiene practice or attitudes or knowledge. So when I am planning my survey, I have pop out so many objectives. So first, age and oral hygiene, gender and oral hygiene, educational level and oral hygiene, then socio-economic pattern and oral hygiene. So likewise, I have pop out so many uh, different objectives. So when I'm summarizing my results, now what I'm going to do is I need to summarize the results for each and every objectives, right? So how the age is influencing the oral hygiene level, how the gender is influencing the oral hygiene, how the education, likewise, I'm going to differ. I'm going to make it uh, small parts. So why I'm doing like that? Then only you can have a clear understanding about your surveyor. If you identified a problem, then only if you make as a whole, then you can't find out the gap. That means gap means you can't find out the problems. If there are problems are still present in the community, then if you have a separate column only, that means separate parts, it will be easy for you to grab an idea. Okay, how the age is affecting, whether the increase of age affecting poorly or if it is in a good manner. If it is in a poor manner, then what you can do for increasing the knowledge for each and every standard, because you in your education sessions, because I told you that how I'm going to educate means I'm going to plan a presentation or whatever I can do workshops, but the workshop that you are going to prepare for grade 6 and for grade 11, it should be different, right? Because the content and the way of your teaching and the tools that you are going to use for your teaching method, actually it should be differs for the grade 6 and grade 10, because grade 10 people, you can use the slides like this and you can include all the words in that. But for the grade 6, they are not having, actually they become very lazy when you are put up all the slides and presentation, all the words, right? So how you can attract your grade 6 people, that means the small children, you can make a posters, like which are having so many picture illustration. When compared to words, if you put so many pictures, then they will like to see. And these puppet shows and the street dramas, so we can, and all the street dramas and puppet shows are really liked by all the age people, but these are some of the methods you can use to attract the small people when compared to the elder one, right? So then only you can identify, uh, if you divide the each and every objectives only, you can identify how you can provide a solution for the each and every problem as well. Then only your assessment outcome is also going to be an effective one. Depending on your nature of your data, you may need to develop graphs, tables, and other visuals to display data as well as the results. Right, yes. So likewise, I told you, like put up a presentation for teaching, and you need to, sometimes you need to prepare any tables, any graphs to express about your results and your data gathering. That means you are putting in a graph that how many percentage of people are having good knowledge and how many of you are having bad knowledge, because putting all the things in a words, compared to that, especially for these research and the surveys, putting up in a graphs, it can be a bar chart or pie chart. It is very, very attractive. One sense it is attractive, and we can identify that one glance, because reading means when you are putting each and everything by words, it may cause the person who are listening to you also may feel lazy, right? So if it is in a graph, then they can get some kind of ideas with that graphical illustration within a short period of time, right? Then when summarizing the results, if you find out any new problems, then you can provide recommendations to sort out in the future. Yes, another important one is providing recommendations. Recommendations means solutions. So if you find out any issues in your current survey, then you can provide the recommendations or solutions which can be undertaken to sort out in the problems, right? And also you can incorporate the things that you have missed in your survey. Then that means you can give a kind of idea for the future surveyors as well. That means if another person is going to do the same survey or the research on the same topic after 2 or 3 years, then you can point out the things that you have missed in your research. Then the person who is going to uh, go through your survey, then he or she can use it as a pioneer survey, and she can find out, okay, what are the things that you have missed. So she can incorporate those missed items in her survey after 2 or 3 years or within 3 or 4 months. Why? Because doing the same thing again and again is also waste of time, waste of resources, and there is no any proper outcome as well. So it is also we are normally putting under the recommendations, or it can be a solution. So this is, we are telling it as think small and big. So when you are analyzing and doing your results, you need to think small and big. So why the problem is like this? So you need to think and you need to create the solutions and the problems according to your results, right? So this is regarding the step 4. Step 5 is get feedback. So you are going to getting the feedback. While developing the assessment deliverable, whether it is a formal report, peer-reviewed manuscript, or presentation, discuss the results with a diverse and inclusive audience, including community members, your colleagues, partners, and other target audience who may interpret your assessment results differently and identify the unique recommendations. You're getting feedbacks. So now you develop all the analysis and you prepare the results from your gathered information and you proposed a recommendation or solution also. But before going to deliver all your results and the solutions to the proper target population or the community, it is better to getting a feedback for your activity or the performance. Because why? So if you are the only individual doing all the things, sometimes we also may neglect some points, right? It can be some mistakenly or some intentionally. We may missed some points, but in another view, it can be some the needy solutions which are expecting by the target population. So how you can sort out this problem before delivering you all your actual work, you can go for the peer evaluation or the presentation. That means you can peer evaluation means you can ask your friend or your co-worker or the colleagues to find interpret your words, right? So you can give all the data to him or her, your peer, and you can ask them to analyze and provide the results and the solutions. Then you can get his findings or her findings and you can cross check it whether there is any new things that you can gain from that person. Sometimes her method of analyzing, her method of developing the results and solution could be varying. You can gain new ideas from that as well. Then those ideas you can incorporate in your solution plan or the care planning method. Or you can ask or you can give it in a target population. That means the similar group of people, and you can check their performance, right? How they are responding to your solutions and all the things. And in that response also you can have, you can gain, actually you can gain different ideas, and then you can analyze all the ideas and cross check with your plan, and if there is any new things you find out, you can incorporate. So that is in that manner why the getting feedback is important, because you can gain more and more ideas and solutions which will be helpful to develop a more precise research outcome. So what actually we are doing, normally we are not, all the things we are not doing for our safety, in order to improve the quality of patient care or the quality of community care. Okay. So in that sense, what we can do is we can gain maximum solutions and the ideas from diverse group of people. In the sense, we can get a very vast solutions. Then you, after all the things, after your feedback, then you can again analyze all the things and you can come up with a new target plan. That means your plan of care. That plan you can directly provide or deliver to your target populations to whom you started to do this research survey. So that is, we are telling it as a getting feedback, right? The next one is disseminate. So disseminate means you are just spreading or sharing. Disseminate, the meaning of disseminate, sharing or delivering or spreading. So you can share your findings internally and externally. Internally means within your group of people, that means to your peers, colleagues, or within your working administration, or externally means you can collaborate with the external organizations like foreign collaborations or any other worldwide collaborations, and you can share your findings that I did one research. That means a simple is a research conferences. Normally, it is common. It is not only in the health social care. In whenever you are going, so there are different conferences they are having in all kind of workplace. So conference means each and every personals we are requested to submit our presentations, so our findings. So it can be an international conference or conference with other institutions or the collaborative works. So in that situations, we can also share our presentations or our findings, what we did. Present your findings at community events, professional conferences, and other relevant venues. Your effort may inform and inspire other public health programs working on similar initiatives, and feedbacks from others can help you to move your work to the next level. So why we are sharing this, it's telling here. So because like you, there are some other personals are also doing the same things. So it sometimes they may have some difficulties to move their activities. So if you share your experience and your knowledge and your data and findings, then they may identify and they can have a new ideas from you. Then what it will happens, they can incorporate their ideas and they can include the ideas that gain from you. Then it will have another new form, right? So if it is a new forming, so there are two different incorporative ideas, then we can develop a new better care plan. So that is the actual use of sharing and sharing the research activities and the knowledge in a public attempt, right? The public places. So it will be helpful to inspire and inform other public health programs working on similar initiatives, and also when you are sharing in a public other places, then you can get more feedbacks from them, different feedbacks. So in that manner, it will be also helpful you to reach, it also will help you to take to the next level of your career. Okay, so in that manner, it will be helpful for disseminate. That is step 6. And the final step is action. So at the conclusion of the assessment process, review your original objectives with the results and recommendations. Doing so will highlight what steps are needed to achieve your goals, whether that is addressing gaps in knowledge or building capacity among the participants. Yes. So the action means what you are doing. It is the last parts, right? So at the end of your assessment process, you need to review, you need to evaluate your original objectives. That means the objectives you set out at the first, you need to review whether they are tally with your results and recommendations. So if we are going to do whether they are tally with this, then you can highlight whether there are any steps you need to improve, or if you identify there are any gaps in the knowledge or building the capacity among the participants, and what are the things that you can improve in your next level. That means what are the things that you can incorporate in order to gain more informations to sort out the problem. So likewise, you can get. So that is the action. Okay, so you are going to put all the things in action. So putting all the things into the action means when doing the action, so the implementation, you need to evaluate your action. So evaluating and the reviewing is more important. These things we studied in all the process in the previous sessions as well. So here also the assessment, when you are undertaking an assessment, the evaluation and the reviewing of your assessment is very much important, right? So these are the 7 steps you need to incorporate when you are undertaking an assessment from an individual or group of people or community, right? So are you all clear about the steps undertake for the assessment process, or do you have any doubts?
Clear, Miss.
Okay. Now we'll move to the next part, referrals, right? So what is this referral means? Normally there are different definitions available. Here I put the 2 definitions, right? First one we'll see. Referral system involves, so you can tell it as a referrals or it can be a referral system because the referral also going to take place in a process. That's why we are indicating it as a referral system. It involves sending a patient to another physician for ongoing management. Of specific problem, with the exception that the patient will continue to see the original physician for coordinate of total care. So what the referral means, normally that means sometimes you may encounter these things. When you're admitted to the hospital, so they may tell the patient, sometimes the nursing officers or the doctors, they may use this word, okay? The patient gone to referrals or so refer or send the patient for the referrals to the X-ray or send the patient for referring or sometimes send this patient for the referral to the cardiologist, oncologist. So what is this sending the patient to the referral means? So normally one physician is responsible for looking after a patient at the hospital setups. Then if that particular individual is having any specific problems, for example, if the person is having any heart problems, okay, then we are referring that particular patient to a cardiologist. Cardiologist means the person who is specialized in a heart problem, the heart surgeon, the common term heart surgeon, or the person who is doing the heart operations and the surgery. So we are referring to that heart surgeon in addition for improving the care management, because sometimes the normal physician, he or she may not uh, able to identify the actual problem in the heart. So in that sense, what the particular physician is doing is he is referring his or her patient to that cardiologist in order to find out the actual diagnosis or the actual problem, or what is the problem present in the heart, and help them to promote a care management or the care treatment for that patient. But here there is, once the physician, the particular physician refer the patient to the cardiologist, so there is that means both the parties, that means the previous physicians and the cardiologist, both they can discuss in order, they can have the discussions when they are developing the care management. Okay, so once he referred to the cardiologist means there is no any interruptions for the normal physician's care, that means the previous physician's care. The previous physicians, he or she can have a visit regularly and they can check how the patient care is going on. Likewise, at the same time, the cardiologists also come and can have a rounds and can check the patient's conditions. So the cardiologist, the heart surgeon, is only referred for the heart problem only, not for the other care management. Other care management will be looked after by the normal physicians who refer the patient to the cardiologist, right? So that is, we are telling it as a reference, or a process in which the physician who has lesser facilities to manage clinical condition seeks the assistance of specialist partner with resources to guide in managing clinical perspectives. Or sometimes, normally it is common, you also can experience, we also have some kind of family physicians, right? So that means whatever, if we have any small fever or if there is any vomiting, that means a minor issues, minor health issues, we will seek a help from a private physicians. So okay, so whatever the problems, health issues occurs, we are always, we have a habit of seeking the help from that particular physicians in a private sectors, right? We are not running directly to the hospital, right? So we can get for the fever, that particular private physician, he or she will provide the medications to sort out. But if the particular physician is not having enough resources, that means if the person condition is some kind of emergency, and if the physician thinks it cannot be sought out with the resources available within him or her, then he refers to a higher person, the specialist person, right? Sometimes if we go to the normal physicians in a private sector, they may tell us, you can you come to the hospital, right? So you come to the hospital at 9 to 10 and refer to this specialist. Or you can see this, you can go and see this surgeon for this surgery. So that means they are giving a reference, right? So why? Because that physician is, sometimes the person is not able to sort out the health issues with the of that particular individual with the resources that he or she is having, or the particular health issues may need an additional assistance or some specific assistance, in the sense the physician referring to the special person, the speciality. That is, we are telling it as a referral in the health and social care system. Sometimes we can refer for the physiotherapy for the exercises, right? So refer for the physiotherapy, or for the X-ray, refer for the radiotherapy. Or if there is any speech, that means talking problems, refer for the speech therapist. So those are the referrals, right? So referrals means one physician is referring to another specialties. Why? In order to improve the care program or care management or treatment of the particular patient. That is, we are telling it as a referral. So are you all clear about the referral now, the term referrals? Did you gain any idea regarding the referral?
Yes, miss.
So here, I told you, as I already told you, referral does not mean transferring the responsibilities. So the physician referring to another physician means the particular physician not transferring her or his responsibility to that cardiologist. So what he is actually doing is sharing the responsibility in the patient care. Means referring to the cardiologist means that cardiologist only check the problems related to heart, and he will prescribe all the management only for that heart problem only. Other problems or the other health issues which develops during the hospitalizations will be sought out by the particular previous physicians. So referring means he is not transferring the whole responsibility to the cardiologist. He is just sharing in order to improve the patient care. That is referral, right? When to refer? So what are the instances you can refer these patients? So first one is when the family physician need specified investigation or advice. So as I already told you, if the family physician is not having enough amount of resources,
or if the health issue identified the family physician of a particular individual is a very big one, and if it is need a specific attention, in that instance a family physician refers the particular individual for a specified investigation or the advice. When the family physician is dissatisfied with the patient's progress or unsure of the diagnosis. Yes, another one. So sometimes if the family physicians cannot identify the actual health issue of the problem, in the sense they can refer for more assistance, or if the person is having a continual care from the family physicians, but the family physician is identifying that the care that they are having is not well enough because the patient health issue is not improving, it is remaining the same or it get worsening day by day, in the sense they are referring for the further assistance or the management. When the patient or his family shows doubt or lack confidence in the diagnosis or management. The opposite side, sometimes the family may have some kind of doubt. The family physician is not giving a proper management, or he is not competent enough to sort out the health issues. So if the family, that means if the individual, the patient or family develop some suspicious thoughts on the family physicians, then they needs to go for the referrals. Then that means they needs to shift the person, the care management. In that sense, the particular individual or family members, they willing to ask for the referrals, right? Please refer to me for these things in that sense. Medical legal concerns by the physician, the patient, or the both. So for the medical legal purposes, that means if for the any legal purpose, we can refer, right? So during the post-mortem, if they find out any problem, any kind of suspicious thing, then or if the patient is admitted, the one patient is complaining that she is admitted due to the assault made by her husband. Assault means the particular patient got beaten, okay, got beaten by her husband. So in that manner, the doctor made a referral to the JMO, Judicial Medical Officer, to handle this issue. So in that manner, it is a legal concern, medical legal concern, right? So the medical legal concern is handled by this JM, Judicial Medical Officer, each and every hospitals we are having. So these legal problem, the legal problems, all the things will be handled by the JM. To seek additional or different services. Yes, like physiotherapy, speech therapy, radiography. So in those things, the additional services, if needed, we can go for the referrals. Or continuity of the care. That means to have a proper continuity of the care. That means if the physicians find out any problem, or if the physician is not able to identify the management, the further treatment managements, in that manner, we can't stop for the patient care, right? So in that manner, to continue the care of the patient, we can refer for the specialized one. To seek admission and management, and also maximize the limited resources and avoid duplication of services. Yes. So once if you are going to refer, you can minimize the service duplication also. Service duplication means again and again providing the same services which is not useful. That is duplication of services. So the unwanted services provide again and again. So if you are going to refer to a specialized person, then you can minimize the unwanted the care management you are going, and the resource also you can use in an effective manner. So these are the most common instances where we can referring or we can use this referral system, right? Now we'll see what are the factors affecting the referrals. Actually, there are some factors having the impact when we are start to do these referrals. First one is availability of qualified consultants. Consultants availability. If you are going to refer, that means the normal the physicians, he or she can refer the person to a consultant. So we need to check, okay, the availability of consultants, whether the cardiologist is available or not, or if the available cardiologist is competent enough to do the heart surgeon and all the things, we need to check the availability of qualified consultants. Physician specialty. So whether the specialty physicians are available or not. If you are going to refer for the cardiologist, the same thing. So whether if you are going to refer a person, then you need to assure that the person is a very specialty in that. Example, physiotherapist. If you are going to refer a patient for treating the muscle problem, then you need to check whether that physiotherapist is competent enough to provide a proper exercises for that muscle problem or the bone problems. Length of training. Yes, so how long did the particular physician got the training? That means how long they are competent in their clinical side. Unexplained findings. Unexplained findings means yes. So normally these referrals, if the particular physician cannot able to identify the health issues, if there are hidden health issues are present, then it will needs for the reference. Uncertainty of diagnosis. So unexplained findings also means the uncertainty of diagnosis is if you are unable to find out the actual health issues. Unexplained findings means once you get the reports, if you are not able to explain the findings, that means if you are not interpret the results of the test report. Okay, so if the physician unable to interpret the test reports of the health issues. So if she or she is not able to interpret the test report means then they can't plan the management. So in that sense, they can refer. And patient characteristics, yes, the patient's problems. So what are the health issues the patient is developing? In that means if whether the patient is having any excess they need knee, or if the patient is having fracture, then how the patient needs is we need to check how extent the fracture is. If it is an internal fracture, we can identify where the fracture happened and what type of fracture is. So all the things we need to seek for the X-ray. X-ray means the referrals may be made to the radiologist, right? So the patient characteristics. So these are the factors that are going to affect in order to start the referring system, right? So are you all clear up to now?
Yes.
Not. Then we'll move on to the steps. So what are the steps we are including in the referral process? So if you are going to do the referral process means what are the things that you need to do? First and foremost, yes, you need to establish a good relationship with the patient. It is not only for referrals, any things that you are going to do in a health sector, you need to first establish a good therapeutic relationship with your patient. Establish the need for a referral. That means you need to find out why this referral needs to be made. What is the purpose? Set the objectives for the referrals. Yes, so you need to set the objectives. So what are the aims or goals of for this referral? Then you need to explore the resource availability. Resource availability means, so if you are going to refer for the cardiologist, you need to check whether the cardiologist is available or not. Or if there is any emergency surgery that needs to be done, for that also you need to check whether the surgeon is available the time is also whether the time management and the supportive assistants are there, equipments are available. So all the things that you need to check. Patient decides to use or not use. Yes. So referrals also patients' right, right? So patients are having the right to use or not use this. That means the patients have the right to refuse this referral as well. Okay. So before referring also, you need to get the consent from your patient. If you are going to refer to the cardiologist, you need to explain why you are referring this person to the another doctor. As you are available, why you are going to refer to the another person, another doctor or the any other. So you need to explain. So what are the health issues we are having, and to sort out these issues, to identify for the problem and to plan the treatment options. You are going to referring this patient to the another person. So those things you need to tell to the patient. Sometimes the patient may tell, no, I need to have another doctor for my care management, right? So there are issues are there. So the patients, actually they are having the right to refuse the referrals. That means you can't tell that referrals should be abide by the patient. It is not the compulsory one for the patients to accept the referrals. Like the consent, they can refuse. That means like when you are getting the consent, likewise the referrals also can be refused by the patient, right? Make pre-referral treatment. Yes, so before the referral, you need to arrange for the pre-referral treatment as well. That means before going for the referral, you can have some treatments, whether without going for the referral, can we sort out this one? Okay, so if that pre-referral treatment also get fails, then you can directly refer the patient. Facilitate, coordinate referrals. Yes, you need to coordinate the referrals. That means between the personnel, and evaluate and the follow up. That means evaluation is also important. Why? Just referring the patient to another physician is not the actual work, right? If you are going to referring your patient, that means you are the responsible person for your patient. You are just asking a help from your colleagues, right? This is the sense what the referral means. You are the responsible one, you are asking the help. So if you are going to ask from the help from another person, as you are the accountable one, you need to check how your colleagues is working on the treatment management. So each and every activity is undertaken by your next peer. That means the referred person or the specialist, you need to check continuously. Like what are the drugs or the tablets he prescribed for taking, and how long he prescribed each and every medications. Or if exercise means whether the patient is following it in a proper manner, whether the patient is doing the exercises properly, or whether the patient is taking the tablets properly, or if there is a clinics, whether the patient is going for the clinics properly. All the things as a proposed physicians, you need to check, right? Each and everything you need to check. So these are the common steps that we are having when we are formulating the referral process, right? Then what are the benefits we can get from this referral? So benefits in the sense we can categorize them. What are the patient side benefits, and what are the family physician, and what for the consultant? So patient means, yes, it is a prompt diagnosis and management. Prompt diagnosis means, so we can identify the diagnosis and treatment, have a kind of good diagnosis and treatment, right? So that is, we are telling it as a prompt diagnosis and management. And for the patient, yes, they can save their time, their effort, their money. So because there is no need to spend the money unnecessarily if they find out the proper referral part. And better outcome, yes. So if we have these referrals, actually the patient's quality of care will be good, then we can achieve the good outcome plan. And if we see the family physicians, learning and training, yes. So referring means, yes, they can learn and train with the patient, because first they can, if they are going to refer to another specialized means, they can identify, okay, I am not competent enough in this particular issue. Okay, so that means if they are not actual, if a family physician is referring to another specialized means, what the family physician think that I'm not competent enough to find out that health issues, or in that sense, I need to develop my knowledge and skills in that particular field. So the family physician starts to develop his or her learning and training. That means he starts to develop his professionalism to another level. Gaining self-confidence, yes, the self-confidence, because actually uh, it a physician needs to have a courage to tell that I can't find out the issue, I'm going to refer. Because think about the situations. If a doctor who studied for 6 years and graduated with the MBBS degree and telling that I can't, or I'm not able to find out the health issue, so I'm referring you to this particular person. So what a common man think about that particular doctor? So actually we will ask, no, so you studied these things, you studied for these 6 years, but you are telling that you can identify the health issues, right? The common people, we actually will ask or raise a question from a question for that particular physician. So each and every physicians, they need to be develop the courage to tell that I'm not able to find out the health issues, or I'm going to refer you for the further management. So that courage should be there. So that is a self-confidence, right? Increase communication between the healthcare staffs, right? And for the consultant, improve the quality of the patient's management. Yes, they can improve the patient's management quality, and also they can increase the communication between the health and staff. So these are the benefits that each and every set of healthcare can gain when we are talking about this referral system. So are you all clear up to now?
Yes, ma'am.
Thank you. Then we move on to the levels of referral. So in the health and social care sector, what are the levels we can have this referrals? So there are mainly 4 levels. First one is from family physicians, primary health care. So normally the family physicians, we are telling it as a primary health care. Why? Because always whatever the health issues originates in our body, first we are seeking the family physicians, right? Not directly to the large hospitals. So in that sense, we are telling them as a primary health care. So the family health physicians, she or he can refer to the hospital specialist, any hospital specialist. And another one is from one specialist to another specialist. Why? Because not all the physicians are specialized in all the fields, right? So from one specialist to another specialist. And from junior specialist to senior specialist, like from normal HO to registrar, or normal registrar to consultant. And from general hospitals to specialized hospitals. For example, so if there is any problem in child, so the small children problem, so in Sri Lanka we are having that. One is the Lady Rigby in Lady Rigby Hospital, which is in Colombo, and this which Srimavo Bandana, not sorry, Sirimavo Hospital, which is in Canada. Okay, so Sirimavo, it is also for the special children, and the Lady Rigby also for the children, specialized children. Okay, so in from all part of our country. If the problems for the children, if general hospitals, think if it is a national hospital, Kandy, or if it is a general hospital in, that means teaching hospital, Jaffna or Kurnagal, whatever, in each and every part of the country, if the health issue of the small children is not these two hospitals. So they are the two specialized hospitals. Specialized hospital we can transfer. So these are the major 4 levels where we can have this reference, right? Then we'll move to the principles. So principles, yes, you obviously know these terms. So what are the guidelines or the points that of following this referral system? So first one is the referral should meet the needs and objectives of the client, should be necessary and appearance. Yes. So if you are going to make a referral, means that referral person should be a competent enough to meet the needs and objectives of the client. Then only you can refer your client to the next person, right? So referring means it should somehow, it should sort out the current issue or the problem or the needs of the client. The client should be able to use the referral in an efficient and effective manner. Yes, the client also can use, because if they find out a new specialist, then they can tell all the problems they can have and they can get maximum use of the referring system. The referral should be individualized to the client. Yes, another thing, normally in the health and social care sector, all the care, whatever we are providing, all are patient-centered care or the individual-centered care. So this referral system also individual-centered plan. The client referral should be timely. Yes, the referral also should be time management. So you can't refer any person with your own, with your willingness, right? So before referring, you need to check the availability, the timing of each and every specialist. Then only you can go for that. Referral should be coordinated with other activities. Yes. So referring means it is not the separate part. It is also the normal routine care. It is also included in the normal routine management. So with the other care, the referring process also need to be followed, and it also should have all the review and evaluation. Should incorporate the client and family members. Yes, referring, it should incorporate like other decision making. The referral making also incorporate the client, at the same time you can incorporate the family members if the client accept it. Client has the right to refuse the referral. Yes, I already told this. And there should be a proper follow-up care for the ones who were referred. Yes. So if the family physician referred, the means the work is not over there. So the family physicians or the other particular physician needs to have a follow-up whether the patient is following the referring properly, whether they are following all the management that were proposed by the referred specialist, right? So these are the principles we need to look out when we are using this referring system. So that's the end of the today's session. Okay, so now it will be for the QA session. You can ask if you have any doubts related to today's lecture, or do you need to clarify anything? You can ask now.
No questions, ma'am.
Okay. Okay, thank you for your response. So others, do you have any questions?
No, miss.
Okay. So I think others also not having any questions. Okay. But if you develop any questions, as usual, you can contact me and you go through the lecture note. I uploaded the lecture note already in the class notebook as well. So go through the lecture note and you can go through the recordings. And still, if you find out any doubts, you can contact me and ask the questions anytime or in the next class. So as you all are okay and clarify, we can wind up the session now. So bye bye all. I'll see you all in the next week. So have a
Thank
nice
you,
evening.
ma'am, and bye-bye.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Bye. Thank you.